Hello, Ms. Thomas. I am Dr. Janisevich. I'm happy to see that you are doing well enough that we can send you home today. I've written 3 medications for you that will be ready with all of your discharge information, and the nurse can go over what I have prescribed for you as well. Do you have any other questions or concerns for me at this point?
No, I'm ready to go home.
All right, Ms. Thomas. Well, I will see you at your 2-week follow-up appointment, okay?
Okay, thank
Take
you.
care. Hi, Nicole. Who's the charge nurse today?
I am.
Oh, perfect. Just what I'm looking for. Can you let the nurse know who's in charge of room number 6 that Ms. Thomas is ready to be discharged home today?
I will let her know.
All right, beautiful. All of her information is in her chart.
Okay.
Thank you.
Thank you. Arvin,
What?
you're the nurse for the patient in room 6 today, right?
Yeah.
This is the discharge information. The physician wants you to go over it with them and answer any other questions.
Hey, one less patient.
Excuse me.
Yes.
My sister-in-law in room 6 was supposed to be discharged over an hour and a half ago.
I'm so sorry. I will page your nurse right now. You should have been in there by now.
Thank you.
Hey, how you doing? I'm Marvin. Getting you out of here. It's been crazy.
What took so long?
It's just been big. I got other patients, you know. You're not the only patients I have. So, a couple things real quick. Let's see here. The home health care nurse is going to be in here to talk to you a little bit.
Home health care nurse?
Is there like a language barrier? The home health care nurse? Okay, she'll be in to let you know what's going on when you get back to your house, about all the other stuff you need to kind of go over. Here's a packet for you for all your information that you need, meds and all kinds of stuff you got to take. If you got any questions, just give us a call for that. But I need you to sign this real quick, right there. You got to date it too.
Here?
Yep. Flip it over. Right there. Okay, good. You got any other questions? Let us know. Have a good one. Take care. Bye.
Arvin, you have the patient in 6 today, right?
Yes.
This is the discharge information. The physician wants you to go over it with them.
Great. I'll get right on it.
Okay.
Ms. Thomas?
Yes?
How you doing? I'm Arvin Dinicio.
I'm good.
I'm your nurse that's going to be discharging you.
Okay.
Okay, look, can I see your wrist? Thank you so much. I just want to go over some discharge information with you before you go. I hope you weren't waiting too long.
No, definitely.
Okay, well, great. I'm glad. First and foremost, I want you to know that I want to make sure that you have all your information. So if you have any questions, please feel free to stop me and ask, okay? The first things first, when we're talking about activities, when you go home, we don't want to have any big activities. You don't want to do anything overly strenuous when you first get home. In about 2 weeks after your discharge, you're going to have a 2-week checkup. Okay, at that point, you can probably talk to your doctor about doing some activities at that point.
You said 2 weeks?
2 weeks, yes. And we have a phone number here for you to get a hold of your doctor as well, okay? Again, with these activities, you want to be able to space these out. Not too close together, so this way you're not, overexerting yourself as well. Like a 15-minute walk or some kind of brisk activity for 15 minutes would probably be really good per day. Okay? Another question is, do you have a scale at home?
Yeah.
Okay, well, great, because what we want you to do is we want you to weigh yourself every single day.
Okay.
Okay? So the first thing you do in the morning when you get up, after you go to the bathroom, weigh yourself just before you get dressed. So this way it's a consistent time every single morning. Okay? So another thing too is the reason why we're weighing you is the fact that we want to make sure that you're not having like serious weight gain. Because at this point, if you're having anywhere from 2+ pounds a day, or anywhere from 5+ pounds a week, you're retaining fluid, and we have to adjust that med, so you have to get a hold of your doctor to do that. Okay? Okay, Ms. Thomas, I also want to talk to you about diet. Okay? We do want to make some alterations in your diet. We want to watch what we're eating. We want a low sodium, low fat diet. Okay? I see also here in your chart that you're a smoker. We need you to quit smoking. Okay?
No more smoking?
No more smoking. Another thing we really want to talk about is alcohol as well. We want you to avoid taking alcohol as well. Okay? The thing I want to go over with you is your medications, okay? This is really, really important. So if you need anything explained, please stop me anytime, okay? Your physician's prescribed 3 common medications for you. The first of it's Lasix, 20 milligrams. You want to take this in the morning, okay? What this medication is for is for your heart. So your heart won't have to work so hard and it reduces excess fluid from their lungs, resulting in the ability to breathe better. Okay. The next thing too, as well, is let's see here. The second medication is digoxin. It's 0.125 micrograms. You'll be taking that in the morning as well. Okay. This drug will improve the pumping ability of your heart by causing it to pump more forcefully, increasing your cardiac output while decreasing your heart rate. Okay. The last is lisinopril. It's 20 milligrams as well. That will improve your symptoms. All right. Do you have any questions? The important thing here is that there are going to be some side effects here, but if you are feeling the side effects that are listed here, and they're really starting to get to the point where they're really a nuisance to you, contact your doctor as soon as possible. Okay. The other thing too is you really want to make sure you take these meds on a consistent basis. Okay. You really don't want to skip these meds because then things will kind of haywire. Okay. So make sure you finish your medications as well. Do you have any questions for me right now? All right, and finally what I want to go over is some signs and symptoms that your CHF is getting worse. Some things you really want to look out for are some shortness of breath, confusion, any alterations in mental status change. These are important, so if you notice these things, make sure you call 911 or go to your nearest emergency room. Okay, do you have any other questions for me right now? Okay, what I want you to do, if you can sign this for me. And what I'll do is I'll go ahead and get transport up here to get you going, because I know you want to get going home. And also the home health care nurse will be coming in. Her name's Julie. She's fantastic. She's going to go over some of the things you're going to be doing when you get home.
Oh.
Okay? It was a pleasure.
Thank
Take
you.
care.
Thank you so much for taking care of me.